best procedure to obtain as close as practical to a sharp jawline? I've never had a sharp or straight lower jaw in my adult life, 40 years old. I recently lost 40 pounds, and I'm in my weight range for my height. From the front, my chin doesn't look too bad, but at any other angle, it looks pretty bad. I've already scheduled a visit with a board-certified plastic surgeon, but would like to know what kind of procedures I may be facing and realistic expectations for what I have. Also, what kind of recovery times to expect.
Thank you for your question. You submitted your question with several photos, and you stated in your question that you've never had a well-defined jawline, that you're 40 years old, and that you've lost 40 pounds. And you have a scheduled appointment with a doctor, and you want to know what you can do to help improve the sharpness of your jawline. Well, I can certainly share with you my approach to helping patients like yourself who come to my practice with very similar questions. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, helping people improve their jawline definition through a variety of strategies. Everything from facelifting, liposuction, and fillers has been an evolution that has continued since the beginning of my practice. So I can essentially give you my physical exam approach that I can't obviously do with just the photos alone. So to begin with, it's important to understand that there are first some anatomic issues, which is the basis for why you never had a very sharp jawline. So what are those anatomic issues? Well, very commonly it is often the arrangements of certain bone structure and soft tissue structures in the face and neck that are responsible. For example, there is a bone called the hyoid bone. And when that hyoid bone is low and forward, or sometimes low and referred to as anterior, well, then you don't get this high defined neck, and so your jawline is not as well defined. Other variables also include the actual structural shape of the jawbone or the mandible. So certainly the genetic component is one part of this equation. The other part of this equation is, of course, the significant weight loss. It is not uncommon for someone after losing a lot of weight to have a relative excess of skin under their chin or in their neck area. Now, from this photo, it looks like your skin has retracted fairly well. And I think that one of the things that's going to be done when you see your doctor is they're going to do this maneuver where you push the skin up to see how much relative skin excess there is. Now, traditional approaches to facial aging when the jawline and neck skin is loose is always some variation of a facelift or face and neck lift. The challenge in your situation is that you're 40 years old. Being 40 years old and male means that essentially there's a challenge to justifying the procedure for the incision that is involved. And this is something I discuss with my male patients every day. When we deal with men above a certain age, and again, it does depend on ethnicity as well and skin type, but even the most well-placed incisions can be more visible in a male patient. There's also a risk of no matter how well an incision is closed and cared for the incision to become either thickened or indented or widened. And again, when people are a little bit older, there's a little bit more forgiveness because of the nature of the skin in the later decades. You're still very young. And so I would be cautious about choosing a procedure like a face and neck lift. Now, a lot of times, a little bit of liposuction along the jawline can help also define the jaw, even if there isn't a lot of fat in that area. Now, this is something that has to be done very, very carefully. And the flip side of this is that your skin still has to retract well enough in order to define the jawline to the way you would want. And sometimes the skin doesn't behave to that level. A lot of times people try thermal energy devices to shrink the skin, but generally speaking, that amount of shrinkage is not that significant. I see thermal energy devices, whether it's a radio frequency or laser-based device, to be more about skin and tissue remodeling more than it is about tightening, especially when you compare to lifting. Another option that we have been employing is called structural volumizing. Now, what's particularly interesting about structural volumizing is that we're actually dealing with the level of the bone where there may be a relative deficit from genetics as well as aging. By placing thicker fillers such as Juvederm Ultra Plus or Juvederm Voluma, you're actually able to define the jawline by enhancing the bone structure. And this may actually be the most practical step for you to do depending on your physical examination. Now, this is a procedure that's not commonly done, so it's something to discuss with your doctor. Basically, using blunt cannulas, we're able to place filler at a level in a way between the bone and the muscles so that the bone structure looks sharper and more defined. A lot of times our male patients who are in this in-between stage of skin being kind of loose but not too loose to justify a lift, or maybe even a blended approach of combining lipo and filler, I think might be the least invasive and the safest approach and the most predictable approach before eventually choosing to do a facelift or face and neck lift. So discuss these options with your doctor. I'm sure your doctor will have plenty of ideas, but I think that from the photos you submitted, I would lean towards the more conservative. I would evaluate the skin to see if there's any value to liposuction, and as well as to structural volumizing with filler to add to the bone structure. And thus, maybe one or the other, or a combination of the two, will give you the better definition of your jawline that you're trying to achieve. So I hope that was helpful. I wish you the best of luck. Thank you for your question.